my name is Dr. Marc Yelle. I'm interventional pain management at Carolina Pain and Spine, a division of Neuro Carolina. I'm a board-certified anesthesiologist and interventional pain management doctor. We're here today to discuss SI joint dysfunction, which is a common source of low back pain in patients. So the SI joint is a joint between the sacrum and the ilium of the pelvis, so sort of the wings of the pelvis come in and meet with the kind of triangle of the sacrum. Sacroiliac joint pain can be caused by a number of different causes. It can be caused by arthritic changes that happen to the joint. It can be caused by inflammation, such as sacroiliitis, that can affect the joint. But it can also happen from degenerative changes that happen over time to the ligaments and muscles that support the joint.
I'm Mark. I'm a videographer. I had my iFuse procedure about 7 months ago. I was on a shoot and we were wrapping up and we were loading into our van, and as I was walking out with some other gear, I was walking and I actually saw these two sandbags, reached down as I was walking and lifted them up. That's gonna kind of hurt. Got to the point that I was not really able to move. When I was sitting, I could not get comfortable. Laying in bed was not very comfortable.
When I see patients with sacroiliitis or sacroiliac joint dysfunction, they often describe sharp pain in their low back. It can be on one side or it can be bilateral. They often describe it as aching, but sometimes sharp and shooting. The pain can radiate around to their hip. It can even go down their leg. SI joint pain is really common as a pain generator in our clinic. And multiple studies have shown that the prevalence of SI joint pain can be between 15 and 30% of all patients with back pain. And in patients that have had a previous fusion, it can be as high as 43% in some studies.
I went to go see a chiropractor, and he had thought that it was my SI dysfunction. He suggested that I come see Dr. Yelle. Dr. Yelle and I went over talking about different possibilities. He said, I think the main thing that we need to address is probably your SI joint area. So we set up a injection. I had pretty much immediate relief. It was pretty amazing.
We really believe at Carolina Pain and Spine that patients should have a kind of a stepwise approach to offering the most minimally invasive treatment to address their pain. We use a really careful history from the patient where they describe their symptoms and the activities that cause and relieve their pain. Also, we use physical exam to ascertain where the pain is coming from. The Fortune's finger test can be one of the most effective ways that patients can tell us where their pain is coming from, as they point right over the SI joint with their hand. We use other provocative tests where we manipulate their leg to try to cause their SI joint pain, and that can really help us localize the pain as well. We recommend that all patients have non-surgical management of their pain, including physical therapy and home exercise. We use treatments in our clinic, injections into the SI joint, which can be both diagnostic and, for some people, therapeutic. Some of them just include local anesthetic, where that numbing agent improves the pain that's coming from that joint. So when they come in to the pain clinic for an injection, we numb up the skin and we place a needle with x-ray guidance so we can make sure that we're right into the SI joint. And then we add local anesthetic, which is the diagnostic portion. Patients get pain relief often within 10 to 20 minutes of the injection, and that can last for a day or two. For a therapeutic injection, we put steroids in, and the steroids can often last up to 90 days, sometimes longer. When that pain relief is not lasting or durable pain relief from an injection or other treatments, then SI fusion can be a great avenue for treatment of those patients. So in patients that have exhausted other means to treat their SI pain, we make a decision together to move forward with sacroiliac joint fusion. We often treat these patients with SI fusion using the iFuse TORQ implant. The iFuse TORQ implant is a 3D printed implant that crosses the joint that is designed to mimic the cancellous bone of the sacrum and the ilium, which facilitates growth of bone into and around the implant. Normally 2 to 3 implants are placed based on the patient's size. The procedure takes approximately 1 hour. Within a short period of time after their implant, we have patients back to clinic for close follow-up to make sure that their incision is healing well and that their pain is controlled.
My recovery was much faster than I thought it would be. It wasn't as much pain as I thought I was going to be in. About 6 months out from my procedure, I am able to go out and do things with my wife, able to do things in the yard, housework. I'm able to do things at work. If this is a procedure that you need for better quality of life, do it. It's well worth it.
Patients can feel lost as to what's causing their pain. So we encourage patients that if they're feeling these symptoms, that they come to clinic and let us evaluate them and try to find the root cause of their pain.